Strapping is an excellent way to test if orthotic therapy will be an effective treatment modality for your patient. The 3 strapping techniques we will demonstrate are Lodi. This can be used for all 4 major lower limb conditions where excessive pronation is a suspected contributing factor. High-Di. This is most appropriate for patients with a high degree of calcaneal eversion on stance and is always used in conjunction with Lodi. False plantar rest. This is an excellent strapping technique for heel pain syndrome and a good alternative to the figure of 8 strapping technique. To make sure that the strapping tape has a nice clean surface to adhere to, you may want to start by cleaning the skin and applying a skin adherent. Lodi is divided into components starting with 2 heel lock straps, several cross straps supporting the plantar of the foot, a final heel lock strap, and finishing with an anchor strap. Plantarflex the first metatarsal head. While holding the foot in this position, apply the first heel lock strap behind the joint line of the first MTP joint. Firmly anchor it to the medial aspect of the calcaneus, running it laterally and up onto the lateral side of the 5th metatarsal head. The reason we apply the heel lock straps while plantar flexing the first met head is that we are trying to shorten the distance from the first MTP to the calcaneus and essentially give the foot an acquired forefoot valgus. Forefoot valgus is typically associated with supinated foot types. We are not trying to put the foot into a supinated position on stance, but we know that once the patient stands, body weight and the fact that the tape will stretch over time means the patient's foot will be in a good supportive position on stance. Repeat again with the second heel lock strap overlapping the first strap by half its width. Do not apply the tape directly onto the first MTP as this can block first MTP joint range of motion. Now we need to apply the cross straps. The first is applied at the distal aspect across the top of the strapping tape, running medial to lateral. The second cross strap is applied across the middle of the foot, starting medially and pulling firmly onto the lateral side. At this stage, you will see the hallux adduct if the strapping has been applied firmly enough. Overlapping that strap by half, apply a further cross strap running medial to lateral. Repeat this process. The number of straps required is determined by the size of the foot. Apply a final heel lock strap to hold all the strapping in place, running around the posterior aspect of the calcaneus and back up the lateral side. Finally, loosely apply an anchor strap across the dorsum of the foot. High-Di is always used in conjunction with Low-Di. High-Di is divided into components starting with 2 stirrup straps and 2 anchor straps. With the ankle at 90 degrees, apply the first stirrup strap, starting lateral forward of the ankle bone, applying supportive pressure to the plantar surface of the heel and finishing up the medial aspect of the leg. Apply the second stirrup strap, overlapping the first strap by half its width. Finish by anchoring the stirrup straps on both the lateral and medial sides. False plantar rest is divided into components starting with fan straps beginning at the plantar aspect of the metatarsal heads, fanning in to attach to the plantar aspect of the calcaneus, plantar straps that run lateral to medial, and a heel lock strap to hold the whole lot down. The first fan strap is applied to the plantar surface of the first metatarsal head with firm downward pressure to anchor it to the medial aspect of the plantar surface of the calcaneus. The second strap is applied laterally to the first strap, overlapping the first strap by approximately half its width. Repeat the same process with straps 3 and 4. Take care not to attach the straps to the Achilles tendon. These should finish on the posterior surface of the calcaneus. Next, apply an anchor strap across the distal aspect of the fan straps and a second anchor around the posterior aspect of the calcaneus. Next, apply cross straps running lateral to medial. The first cross strap is applied in the middle of the fan straps, firmly anchoring the fan to the foot and secure to the medial side. Repeat this distally, overlapping the previous strap by half its width. Repeat this process moving both distally and proximally. The number of straps required is determined by the size of the foot. Finally, anchor the strapping down by applying a heel lock strap behind the first metatarsal head, over the medial straps, around the posterior of the calcaneus, finishing on the lateral side of the foot. For large or heavy people, you can use a combination of false plantar rest and low die for extra stability. Plantar flex the first met head and apply the first 2 heel lock straps in the low die technique. Then apply the false plantar rest, including the fan, anchor and cross straps, and finish with a final heel lock strap. Remember that the tape will stretch as soon as the foot is weight bearing. Wearing shoes minimises this stretching and preserves the strength of the tape so it can support the foot properly. So please ensure your patient understands the need to wear shoes at any time the strapped foot is weight bearing.